Hi and welcome to Steps and Strides with me, Connor Ratcliffe. Today we're back in the garage gym and we're looking at some potential loading strategies for the peroneals. Today's exercise is non-weight bearing resistance band work. So it's resistance band, plantar flexion, eversion, dorsiflexion, eversion, or we'll look at more isolated eversion exercises. So 3 for 1. So today's setup's nice and easy again. We're going to set up in this position and we'll look at the slightly more complex movement to begin with. So you want a reasonable resistance on the band, and if we want to look at the plantar flexor everters, so peroneus longus, peroneus brevis, then we're going to start from this position, so an up and in position. So we're going to dorsiflex and invert, and then from there we're going to push down and out. We're going to plantar flex, evert. Nice and slow on the way back. Nice and controlled. Up and in, down and out. Now sometimes that can be a little bit of a trickier movement because we're working through a full arc range of motion. So if I just wanted to simplify this a little bit, then what I might do is add a bit more resistance by changing the angulation of the band. I'll put the sagittal plane start position in plantar flexion. So what that means is I'll say push your foot down, push your toes down, and then this becomes our start position. So we start from plantar flexed inverted, we end plantar flexed everted. So it makes it a single plane movement. So we're just working through the frontal plane. And we're coming from all the way in to all the way out, just moving at the ankle. Typically the cues that I will give patients. Just moving at the ankle, nice, slow and controlled. And again, if people are struggling with this a little bit, the nice thing with these movements, see my poor eccentric control there, is that you can just modify the range. So we can work from inverted to neutral, we can work from neutral to everted. So we can modify the arc of the movement depending on what the patient's tolerance is. So likewise, if we wanted to bias more of the dorsiflexion everters, so peroneus tertius, extensor digitorum longus, I'll just move the start position. So we'll start from dorsiflexed, inverted, and then we'll evert. And typically, most patients will usually find that a little bit easier. Now, if we wanted to work through full arc, then we'll start from plantar flexed inverted, so down and in, and we're going to come up and out. Now really, to get a better engagement on this, you need your band tied off the other way, or you can sit in this position to undertake it. So I'll push my foot down and in, and I'll push or pull up and out. Now some of the common compensations that we might see again is for peroneals. People like to abduct leg, so if the leg starts moving, that's not what we want, we're getting the wrong target muscle. We start getting external rotation of the limb, again, different muscles. So I'll always cue just moving from the foot, just moving from the foot. And especially when you've got active pain or history of injury issue, these compensations might be more obvious and more ingrained. So again, it's not just handing the sheet out to someone and saying, cool, you need to push down and out or follow this exercise. We need to make sure they're doing it correctly, so we're actually getting the target structure. The other thing that you might see is if you don't cue this one way or the other to your target structures, if you just do non-specific eversion in kind of a neutral position, you often find that you get a bit more digital engagement and extensor digitorum longus taking over, which is fine, it's not necessarily a problem, but if you actually trying to target peroneals, obviously you're not getting your target structure. So make sure you've got that set up correct and make sure you're looking for the engagement through the structures in the lateral compartment and your patient or client can feel that engagement through the target structure that you're looking to load up, strengthen, increase tolerance or capacity for. So that's another potential loading strategy for our peroneals. That's TheraBand eversion, or eversion against a resistance band in a plantar flex position or a dorsiflex position, or through full arc. So plantar flexion, eversion, dorsiflexion, eversion, depending on if you want peroneus tertius, extension digitorum longus, dorsiflexion eversion, or peroneus longus, peroneus brevis with plantar flexion eversion.